Okay, so these days, staying fit and looking our very best generally includes more than just routine gym visits, keto, low-carb diets. Many are also looking for other highly effective and affordable ways to also look their very best, and why not? With us to discuss the benefits of non-surgical in-office facial and body revitalization is Dr. Alexis Sykes. She's a board-certified plastic surgeon based in Jupiter, Florida. Also joining us today is one of her patients, Angie Reed. Welcome to both of you.
Thank you.
Thank you.
Love talking about this because I'm always for non-surgical. I'm kind of like a little bit of a chicken doctor. So let's first talk about just the options of surgical and non-surgical and where we are today.
When I first started my training, my practice, surgery was pretty much it. But since then, we've had a lot more products and things you can do, devices, lasers that have all come out really in that period of time. It's amazing. Mm-hmm. And there's so many different things to choose from that I have frequent seminars to tell people what their options are.
To each his own.
It's important.
Right? For you, Angie, did you like the surgical route or were you looking more like what I would be looking for?
Exactly. I did not want the surgical route. I was definitely looking more for fresh face, but not surgery.
I was reading here, doctor, that you take on, and I'm going to just quote it, an oriented approach with your patients. What does that mean?
Problem-oriented. We're going to focus on what the patient is looking for. Now, some people say you can do what you want, but other people say, my mouth really bothers me, or my eyes really bother me. And if I haven't done that, at least they're not going to be happy. So I'm trying to make them feel better when they look at themselves in the mirror. That's kind of what I see my job as being.
So what I'm hearing is almost like a team approach where you have to discuss with the doctor what bothered you and you're going to tell us, and then she kind of gives you her input as well.
Absolutely.
Okay, let's talk about the non-surgical approaches. I know there's a lot of them. The first two that come into my mind, doctor, would be fillers and Botox, right?
That's probably one or two. Neurotoxins, and there's like 4 of them now. You can use mainly for the upper face. The fillers are lower face, temples, mainly face. We're using them actually off-label now on other parts of the body too. It's amazing what there's available, and the research is being done.
And we have video of something called M-Sculpt. What exactly is this?
So this is a device that it stimulates muscle to contract 20,000 times in half an hour, for example, the abdominal area. Stimulating the muscle and at the same time taking some of that fat layer in this same area and reducing it on a permanent basis. So it's actually kind of like liposuction or some of these other devices plus the muscle. So it's like a dynamic, the muscle and fat, in your body. When you're helping the muscle and the fat at the same time, it's just I think it's a healthy way to go.
Angie, did you do that?
I did do it, yes.
Did you feel a difference in your core?
Absolutely. It made a huge difference in my core. I needed to get stronger there, and I definitely am stronger.
Did it hurt or anything?
Not at all.
Nothing.
Not at all.
Safe and no risks involved, doctor? Because I'm always into the safety.
Pretty much not. I mean, you can't have metal in the area. There's a couple things you have to know about, but and again, you have to be safe, right?
Always. Always. I have a before picture of you. I haven't seen it. Someone told me, wait till you see this. Wow. So this was before you did anything.
Yes.
So then, if you don't mind sharing with us what you've done to your face.
Yes, I had cheeks done. I had around my mouth and my forehead. And I actually had a bump removed from my nose.
Okay. And yet, I look at you and you look very natural, very refreshed.
Yes.
Nothing,
I feel that way.
out of the ordinary, right?
No, correct.
So you were happy with everything?
Absolutely. Couldn't be happier.
Doctor, I mean, not too shabby. That's pretty good. Do patients tell you this is fantastic? Thank you so much.
Oh, I love doing it, and I love making them happy too. It's just it's a good feeling.
Speaking of love, I know you're obviously an artist because of what you do for patients, but you kind of first started really as an artist. You didn't write these books, but these are your illustrations?
Correct. That's correct. Mm-hmm.
That's fantastic. And I know we have some work that you also, paintings that you got awards for. So you've really had this kind of calling from...
Oh yeah, I've always loved art, yeah. Since I was a little kid.
Did it kind of inspire you to then maybe do this as well?
Yeah, well, until I got to high school and I just decided biology was pretty cool also, and that maybe I'd, do a little better in the rest of my life if I could always do art, right? But you can't always do medicine. So I kind of did medicine first.
That's a great combination. I know it's fabulous to look great. We all want to look great, but I can't end but discussing about just safety and finding that right person. We hear of the horror stories of people who have died, people who have been scarred for life. Doctor, talk about the importance of finding really a very good doctor. Board certified even is like a nice little check Why so?
Well, all the training's involved. You basically have, and you're tested. You don't get board certification until you've been tested by the experts, and there's a lot of study goes into that. Once you've done all that and you've had all the training, then you're ready to go out in the world. There's a lot of people that are doing things now that don't have any of that training.
Yes. Do your homework.
Exactly.
Do your homework. Any advice for anyone out there like me who's thinking of maybe doing the M-sculpt, which we saw the video,
Yes,
and
exactly.
anything else?
Yep, just go for it. Just be your best self.
There you go. Doctor, what would you do to me? Come on, be honest.
Well, maybe a little cheeks, and you could maybe use a little something here. I mean.
Come on, I'm gonna go see you.
So afraid.
I'm such a chicken. For our viewers, if you live in maybe Palm Beach, Broward, Miami-Dade, where can they go to find out more about you?
JupiterPlasticSurgery.com.
JupiterPlasticSurgery.com. Thank you so much for your time, and thank you for looking so fabulous. You look.
Thank you.
Your husband must be like, wow.
I love it.
I love it too. Thank you so much. I
Thank
appreciate you
you.
sharing your story. And for our viewers who'd like more information, you can go to our website, thebalancingAct.com.